My name is Dr. Rob Gordon, and I'd like to congratulate you on obtaining your new 200 series Storz device. It's a fantastic device, and today my job will be to show you how to assemble your new 200 device. The exciting features of this machine are the new tablet, the vacuum or suction or cupping devices, the controls in the handpiece radial device, and the combination Shockwave and vibration handpiece. So let's get started. The first step is to set up your tablet. You'll have a box that the tablet came in, and you will take out this black cord. This black cord has a micro USB that will go into the side of your tablet, like so. And the other part is a USB that will go in the USB port in the back of the machine. The next cord that you will take will be this white cord. And once again, there is a USB port on the tablet that plugs in like that. And then there's a square end that matches in the back, right in the middle of the machine, into the square white port in the back of the 200. Once that is done, we're going to take our power cord that came in the box, and this three-pronged end will go into the back of the machine, and the other end will plug into the wall. Once it's been plugged into the wall, we can turn on our tablet, and there is a small button on the top of the tablet, and you will hold it down for approximately 10 seconds. Now we're going to put in our hand pieces. The first one that we will get is the combination V-actor, vibration, and shockwave. And what's very important with all of these hand pieces is that there is a red dot on the silver part of this hand piece, and that red dot will match up with the red dot on the side of the machine. Red dot to red dot, and your V-actor is set. The next one will be the radial handpiece. Again, there's a red dot. That red dot will match up with the red dot here and will be plugged in. Now your radial handpiece is ready to go. The final one is your cupping. So you can pick the cup of your choice. I'll take the small one, clicks in here, and then the other end clicks in to this white port on the side, and it says cupping. Once you hear that click, you know that it's been put in properly. Now in the back of the machine, you'll turn the power on. It goes from the 0 to the 1 setting, and that means that your power will be on and you can hear it setting up. Once this is done, you're ready to use your new device. So one of the most exciting aspects of the new 200 is that with the tablet, you can control everything by finger and touch, or you can control using the handpiece. So now that we've set up the tablet, you can see that it's on RSW, or radial shockwave. So that corresponds to the handpiece. So you can see here that the handpiece corresponds to what is on the screen. So let's say we want to increase our pressure or bars. We can go to 2.6. It changes on the screen and it changes on the handpiece. So you can control it either by the handpiece or the screen. One of the advantages to that is that as you're treating a patient, you can decrease the bars or pressure or increase them. And it increases by hand, manually, or on the computer. The next thing is the V-actor. So to use the V-actor, one would simply touch the V-actor, and again, it is all preset. The beautiful thing about the 200 series is you can actually control the frequency of the V-actor head. So you can go 17, or I can go to the maximum of 21. I can also increase, again, the energy level, or decrease the energy level of the V-Actor, which is a great new feature of this 200. Lastly, using the cupping, one would hit the vacuum A, and all your settings are there. Once again, a really fantastic feature of the cupping is you can do intermittent cupping or continuous cupping. And I will show you that in 1 second. So now that we've set up the cupping device, I will show you how it works. You apply it to the skin, hit start, and it automatically starts your cupping. You can see by the setting that this is a continuous setting. Some practitioners like intermittent, so you would hit intermittent, and now you have intermittent. And you can increase or decrease the pressure settings. And now you've got much greater suction and cupping, and now it's on intermittent. And let's say you want to switch to continuous, all you do is hit the button. And you can also set it to time. This is set to 10 minutes. You can set it anywhere from 1 minute to 10 minutes, whatever you prefer. To use the V-Actor, you would hit the V-Actor part on the tablet. It is already preset. All you do is hit the button. And of course, using gel, you would work the myofascial components of your patient. The radial part, you would hit the radial part of the tablet, and to start the handpiece, you hit the button. To stop it, you hit it again. Very simple to use, but very effective. And the cupping part, you would hit the cupping, you would hit the vacuum, put it in position as talked about before, and hit start, and your cupping would be started. Thank you for your attention, and I wish you all the best with your new device.